This is, in effect, a government on a wartime footing, a government calling for a collective national effort, as Boris Johnson would do, quotes, whatever it takes, warning of even more extreme measures to come. While the Chancellor, Rishi Sunak, promised a £330 billion package of government-backed loans and guarantees, along with cash grants for smaller firms, promising that if demand was greater, it would be met. The Prime Minister insisted the government and society was there to, quote, look after people thick and thin. Our political editor, Gary Gibbon, has this report.
Rush hour this morning, a commuter ghost train. The train from Gatwick, empty. London's Covent Garden, a ghost town. One day after the government clamped down on socialising and work travel, the Prime Minister and the Chancellor tried to address the howl of pain from employees and businesses who fear they're staring into an abyss.
We must act like any wartime government and do whatever it takes to support our economy. And that's the main purpose of this press conference this afternoon. We must support millions of businesses and tens of millions of families and individuals through the coming months. And to do that, the government machine must and will respond with a profound sense of urgency.
This national effort will be underpinned by government interventions in the economy on a scale unimaginable only a few weeks ago. This is not a time for ideology and orthodoxy. This is a time to be bold, a time for courage. I want to reassure every British citizen this government will give you all the tools you need to get through this.
The pace and virulence of the virus changed the government's health advice yesterday. Today it rewrote a budget at least 6 days old and challenged decades of Tory economic thinking.
And in the coming days, I will go much further to support people's financial security. In particular, I will work with trade unions and business groups to urgently develop new forms of employment support to help protect people's jobs and their incomes through this period.
That was a hint at the government paying employers to keep workers in their jobs. It came on top of cash grants to smaller businesses and billions of pounds worth of government loans.
We have never faced an economic fight like this one, but we are well prepared. We will get through this, and we will do whatever it takes. Thank you.
As you'll have gathered this afternoon, we are going to do whatever it takes. Thank you all very much.
That phrase echoing the language leaders used after the 2008 crash and the euro crisis, an open-ended promise meant to reassure. NHS bosses giving evidence to MPs were asked if the government call for people to stay apart from each other might avoid the NHS being overwhelmed by more patients than it could treat.
Do you think the new guidelines issued yesterday to the public about social distancing would be more effective if they were mandatory rather than advisory?
Well, I think we will know the answer to that question within a matter of days. And as I think we heard the Prime Minister say yesterday, obviously the first approach is to appeal to the good judgment and altruistic instinct of the British people. But if it turns out that further measures are required, then I'm sure the scientific advisors will put those before the government to consider.
I can't be plainer than to say the importance of adhering to these measures as much as you possibly can is going to make the difference to whether the NHS copes or not. It's as plain as that.
Some NHS leaders sound like they want a full legal crackdown on movement, including the shutdown of schools and universities. They may not have long to wait. Non-essential operations will be postponed, the NHS said, over the coming weeks to free up beds for COVID-19 victims. The bleak ambition, if all these measures paid off, was spelled out.
The total number of deaths, rather than being in the hundreds of thousands, could potentially get below 20,000.
That is the hope, that we can get it down to that. And to put that into perspective, every year in seasonal flu, the number of deaths is thought to be about 8,000 excess deaths. So if we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak, but I mean, it's still horrible. I mean, that's still an enormous number of deaths, and it's an enormous pressure on the health service.
The government has tonight published an emergency powers bill, which it hopes will ease the pressure on the NHS, allowing the government to shut down ports and airports temporarily, lower care standards, speed up funerals, and allow the police to detain those with the virus. The clampdown, only announced yesterday, already being superseded in the race to stop COVID-19 engulfing the National Health Service.